Hello, everyone, and welcome to the webinar today. Uh, First, before we get started, I want to draw your attention to the stream text link is in the chat box. In addition, you can go to your icon at the bottom of the screen, which says Show Caps, and you'll be able to click on that for the captions to appear on the screen. And of course, we have spotlighted the two ASL interpreters. So with that accessibility underway, we will start today's webinar. My name is Ruth Warick, and I'm the Senior Director of Strategic Initiatives and Impact for Wavefront Centre for Communication Accessibility, as well as being the President of the Canadian Hard of Hearing Association BC chapter. And these two organizations are the sponsors for World Hearing Day webinar that we are delivering on ensuring hearing health for living well. Before getting started further, I would like to take a moment to express gratitude to the nations of Musqueam, Squamish, and Tuscalwell for the unceded homelands on which Wavefront Centre operates. Now for some information about World Hearing Day. Annually, the World Health Organization promotes March 3rd as World Hearing Day. It originated at first in China. And the goal is to encourage a recognition of the importance of ear and hearing health care, promoting behaviors to protect our hearing and to ensure for hearing as well as we can have. And this is both on an individual basis and at a society level to deal with systemic changes that are needed. So for our webinar, we have an exciting lineup of 3 panelists who will address hearing health for living well, and I'll be introducing them shortly. The format that we're following is that each panelist will present briefly, then we will have a question period. That will also be brief. And after all 3 have spoken, we will have a bigger question period at the end. We will ask you to put your questions in the Q&A box, which is at the bottom of your screen. If you're not able to do that, we will accept questions in the chat box. So we will do that both for the brief question period and then the bigger question period at the end. Now, we would like to have a little more information about you as participants in terms of whether you have a hearing loss, what type you have, and whether you, in fact, are a person that doesn't have a hearing loss. And you are fully welcome to be part of this community to protect and also advance hearing healthcare. So we have a poll, and I will ask Gordana Moser, who's working at the back end, to please put up poll number 1. So this poll asked you to identify yourself, a person who's hard of hearing, who's deaf, who prefers to identify as having a hearing loss, or doesn't have a hearing loss, or doesn't want to comment. And I'll give another 20 seconds so everyone gets a chance to fill out this poll. And then we'll show the results. Okay, I think we probably have enough responses. I don't see more responses coming in. So we have 13 out of 27 who've answered the poll who identify as being hard of hearing. And we have 5 who prefer the term hearing loss, and 9 people who do not have a hearing loss. So thank you so much. I'll share the results so you can see the results yourself. We can take down that poll, and we now will have a second poll. I'll just wait for this poll to come down. Brenda, will you show us the next poll? Great. So this is a poll to ask, oh, this is the one we already had. So we don't need this one. It's just the second one. We can take this one down. Okay, let's just go a little further. Here it is. I think it's question number 2. Okay, sorry. Okay, please answer question number 2. We see it here. To what extent do you think people in general recognize the importance of ear and hearing healthcare? So select one answer. We'll give you about 20 seconds or until we think everyone's responded. Okay, it looks like all those who are responding to the question have responded. So there's 2 out of the respondents who think, well, let me share the results. Maybe it's a little different. Okay, 2 who think it's to a large extent, 12 to a moderate extent, and 8 to a small extent. So no one has answered to a very large extent or a very small extent, with most answers being to a moderate extent. And it'll be interesting to hear from the panelists what they think about that, but we can hear about that maybe a little later after their presentation. So we will stop sharing the results of the 2 polls. Thank you so much for taking part in them. And now we're going to begin with the first presenter, and I will introduce each presenter just before they give their talk. So the first presenter is Rebecca Angel, who is the Director of Audiology and Business Transformation at Wavefront Centre. She just started a month ago, and she's overseeing clinical growth and operation and supporting the audiology team to ensure exceptional care for you. Her creative approach, backed by a certificate in graphic design, helped her communicate complex concepts effectively. She's passionate about communication access and dedicated to empowering individuals and advancing inclusive hearing healthcare. She has a master's degree in audiology from our University of British Columbia. Over to you, Rebecca.
Thank you so much, Ruth. It's nice to be here. And yes, I'm just 1 month in. And I'm happy to participate in today's webinar. So thank you for including me. I am an audiologist, and I've been in the industry for just over 10 years. And I'm going to talk to you today about taking care of your hearing health from the perspective of an audiologist. So to get us started, I do like to talk about the magic of hearing, and it's not often that I get to talk about it anymore, but it really is just such an amazing, like, series of events that has to happen. So these invisible sound waves, they travel through the ear, they enter our ear canal and set this kind of vibration of the eardrum, the middle ear bones, the tiniest bones in our body that have to move in such a way to send a message into our cochlea, so that little snail shell there. And that's filled with fluid and hair cells, and these tiny hair cells will react differently depending on what type of sound it is or what pitch that is. And this will send an electrical signal up through the auditory nerve and into the brain. So you start to make meaning of what you're hearing. You can start to make sense of what those sounds are. Before you even realize it's happening, you've heard the sound, you've processed its meaning, and you're hopefully ready to respond. So by the time I finish the sentence, your brain will have already worked out its magic and heard and understood, hopefully, what I've said. So it's really an incredible process when you think about it, and a lot of things kind of have to work together for this to happen. And then, of course, our brain plays a really big part of that process as well. Oh, I went too fast. So, of course, I think as an audiologist, I know why hearing health matters and why it's so important. And I do think that it's becoming more, mainstream to talk about hearing loss today than it was perhaps 20 years ago. But it really is so important for communication and connection. And it really does impact so many different aspects of our lives. Um, at least for me, like, communication and connection is so important to my overall well-being. As humans, I think we have this innate desire to connect and engage with others. Um, it's really important to our relationships and our mental and emotional well-being, our cognitive health as well, and just our overall quality of life. And when you have a hearing loss that goes, ignored or untreated over time, the brain does have to work harder to process sound. So this can lead to things like fatigue, feeling more tired at the end of the day, feeling more tired after a big social event. Um, and these can sort of lead to other things like social withdrawal. So there might be this avoidance of conversations or avoidance of social events due to communication difficulties or that fatigue that kind of occurs after such an event. Um, you might start to withdraw from, like, everyday things that you do. I think back to when my dad had a hearing loss that was untreated, perhaps undiagnosed for a long time. He started retreating from family dinners at the table because he really had a hard time following along. And, he also didn't really feel supported back then. So he would sometimes leave early because it was easier and less frustrating to stay. Um, which of course can strain our relationships with family, with friends. There can be frustration around miscommunication, and we can start to sort of emotionally distance ourselves as well. And there's a lot of talk about, mental health and brain health, but if we have this increased isolation, if we're not communicating as freely or as easily with others, that can lead to things like depression, anxiety around certain events, and also this increase in cognitive load. So most adults in Canada are, unaware that they even have a hearing loss. So if we look at men versus women, it is pretty similar. So 63% of men that had an actual measurable loss, only 8% of them actually self-reported experiencing any sort of hearing loss. And then for women, it was 46% of them having a measurable loss, and only 5% of them actually reporting that, self-reporting that hearing loss. And it does rise with age. So this is talked about in all kinds of industries now, but we do have this aging population. So the prevalence of hearing loss does rise with age, and we're seeing, this baby boomers are getting a little bit older, and so more than 65% of people over the age of 70 will have a measurable hearing loss. And we know that a lot of people work in noise, and we do live in a more noisy world than we used to. And there will be an increase in research on this aspect as well, in terms of noise exposure and whether we see younger people getting a hearing loss due to that noise exposure from concerts, from recreational sort of work. I was trying to go to sleep a few weeks ago, and my husband is in the garage and it's very loud. And I'm like, I wonder if he's wearing hearing protection. Of course, I went down there and he wasn't. So I sometimes think people don't realize, recreational garage work or whatever you're doing with home tools is actually going to have an impact. Um, and then on average, people are waiting a long time before they're treating their hearing loss. So people wait to do anything about it. It can be a gradual thing that happens over time. It's not so much noticeable at the beginning. And, perhaps it has to get really challenging for you to say, hey, I should really get this kind of looked at. And then there's a large portion of the population who could benefit from hearing aids, that haven't even gone to check, and they could actually benefit from them, but they've not even kind of had that conversation. Tinnitus is something that we also get asked about a lot because it really is very common. 10% of the population experience, a mild form of tinnitus. And tinnitus or tinnitus can take many different forms. It can be heard as a ringing, it can be a buzzing, a humming, a whistling sound. It can be intermittent, it can be constant, it can be in one ear or both. And for many, it's subjective sound, which means only the person who has it can hear it. There's lots of research being looked at tinnitus and and there are some known causes, but there's a lot of unknown causes. So there's lots of research being done in this field, but sometimes the cause of it will remain unknown. That doesn't mean it's not there. It's challenging to kind of pinpoint one exact cause. But tinnitus and hearing loss can often coexist. Sometimes tinnitus can be an exposure to loud sounds. I don't know if you've ever gone to a concert and then, your ears are ringing at the end of the night. I've definitely had that happen, but of course it goes away for some people. It's a natural aging process. It can be a sudden impact noise. It can be a result of head injury, certain medication, and sometimes emotional distress can elevate that tinnitus as well. So although it's common, the causes and symptoms will vary, and each tinnitus case is really unique. It does require a personalized treatment plan, and this emotional component, like stress and anxiety, can make the sound of tinnitus more bothersome, and rightly so. It's a challenging thing to cope with sometimes. But always recommendation is to begin with a consultation with an expert in tinnitus. So a hearing care professional that sort of works with individuals that have ringing in their ears. I did put up some useful links here that I like to reference sometimes. So I'll just leave those up there for a minute and you can snap a photo or we'll share the slides. So some common symptoms of hearing loss that come across the clinic, and you may know somebody that said this to you, or perhaps you've experienced this yourself, but asking people to repeat, or it sounds like others are mumbling, turning up the volume on the TV, difficulty hearing over the phone. Understanding speech in noisy environments is a big one. Of course, I mentioned this before, but feeling more tired after events. If you've noticed you're kind of looking at reading lips a little bit more, mishearing what people say. Typically, we lose the higher pitches first, so that's kind of those S and T and SH sounds, so sometimes you mishear certain words. And like I said, tinnitus and hearing loss can often coexist. So sometimes having a ringing in your ear could just prompt you to have a baseline hearing test done. So what can we do? regular hearing checks, it's not something that everybody's doing, but I do recommend a baseline hearing test, at around the age of 50. It helps with early detection. You kind of get a baseline. You can start to notice when changes happen sooner, which allows for a more proactive management. You can look at different communication strategies to help you hear a little bit better so you don't kind of start to withdraw from those settings. Communication is a two-way street, so we can often help friends and family with some communication tactics there too. Using hearing protection in noisy environments, if you're at work in noise, concerts, using machinery at home. One thing I didn't mention up before is to definitely seek immediate help if you ever were to experience like a sudden hearing loss or a sudden change in your hearing. Maintaining an active and healthy lifestyle that goes both physically and emotionally, it's all sort of an overall well-being, but hearing is definitely a part of that. And then considering hearing aids or assistive devices early to stay connected and engaged. Don't ignore it. Sometimes we get used to this quiet world that we live in, and it does take time for the brain to acclimatize and adapt to hearing aids. So I'll kind of speed up here. I should have checked my time, but I did want to give you just an idea of what to expect at a hearing assessment. Sometimes some of you may know this already, but you will be asked about your overall health, your hearing, your lifestyle, any concerns that you have. Check inside your ears to make sure everything's clear. There could be some wax buildup in there sometimes. We can use special equipment to test the middle ear function, how the eardrum is moving. And then you'll do a listening test. And this is both to kind of find which pitches you hear better than others, what that hearing looks like, and you'll listen also to speech. And then you'll be provided with an explanation of your results, and any questions that you have will be answered. If there is a hearing loss presented, then different options will be provided to you, whether that's hearing aids, whether that's assistive listening devices, whether that's communication strategy, like lip reading classes and things like that. You should be provided with education and tips on your hearing loss and the communication strategies for everybody. And it really is just a quick, easy, and informative appointment. With regards to hearing aids, there's so many different, types and brands and styles and power levels, and different types of hearing loss configurations will require different types of hearing aids, and that could be dexterity or vision. And so you'll be chosen the right hearing loss for you. You'll be showed how to use them, maintain them. There's lots of follow-up adjustments, lots of fine-tuning. Like I said, your brain needs time to adapt, but there will be ongoing support and regular checkups. So this is my last slide, but things to kind of look for when choosing a hearing clinic. Be sure to use a clinic that you feel comfortable with, skilled clinicians who can guide you through the process, people that can answer your questions and really take time with you, provide, personalized and unbiased recommendations. Someone you trust, someone you can ask questions and discuss concerns, clear communication and education and ongoing support, and just a comprehensive service. So it goes beyond hearing aids, but it's really about that journey that you have with those hearing aids. They will give you a long time, and you want to, have somewhere you can get help. They offer a full range of services, tinnitus management, of course, if that's important to you, but also being able to offer assistive listening devices and other communication strategies as well. There is my email, so I'm more than happy for anybody to reach out, but thank you very much for having me. Back to you, Ruth.
Thank you so much, Rebecca. Very informative, and maybe we could take the slides down. Great. So we are open for a few questions. We have a few minutes if someone would like to put them in the Q&A or the chat box. let's just see if we have two questions, I think, in the Q&A. So the first question is, do you have contact information for those who specialize in tinnitus or tinnitus? I'm not sure which way to say it. I have profound hearing loss and tinnitus in my right ear.
Well, I'll have contact information for Wavefront. We have a clinician or a couple of clinicians that really specialize in tinnitus, but also hyperacusis, which is like sound sensitivity, at our Kitsilano location. So I'd be happy to share that. Sometimes a quick Google search for hearing clinics in your area, you can always send them a message and see, if they have someone who's specializes in tinnitus retraining therapy.
Right, and then the next question is, are hearing tests covered by BCMSP? Are there any studies of hearing loss associated with long-term wearing of headphones, earbuds?
So unfortunately, hearing tests are not covered by BCMSP. For a little while, I was on like a volunteer board to try and kind of change that around hearing aids, but also hearing tests. But a lot of extended health will cover, but not BCMSP, to my knowledge. And as I'm sure there are, I don't know any off the top of my head about long-term wearing of headphones or earbuds. So I can't really comment on it. I know there are some, but I don't know if we have a long enough, uh, database or group that we can sort of, I think we may have to wait a little bit longer and see what's happening with that. But it is a concern.
Thank you. And then we have two more that we will take before we go to the next speaker. Why is it so much harder to hear people in small rooms with loud noises than large rooms?
Good question. There's this thing called reverberation and space. It could get quite technical, like the time it takes for a sound to reach one ear and then get sent over to the other ear. There can be, if you're in a small space, that kind of bouncing around of sound is going to be a little bit more overwhelming than if you're in a large space. It kind of can spread out a little bit more, so you can kind of distance yourself from some of that noise or that echo. So reverberation, in addition to noise, are very challenging listening environments. Sometimes even large rooms can be difficult too. But if you're in a small room with lots of hard surfaces and walls for sounds to bounce around on, it's going to be very challenging, even for people with normal hearing, often to hear in those situations.
And this will be the last question before we go to the next speaker, and the others we'll have to deal with in the bigger question period. The cost can be a barrier. Any thoughts?
Yeah, also a good question and a tough one. There's many different price points that you can sort of look at. And sometimes there can be additional funding for certain populations. One thing that I would suggest is just making sure that you are, seeing someone who's willing to sort of work with you in your budget. And it's not just about the cost of the hearing aids, but the service that you're going to be provided with as well, and having someone that's going to kind of help you through that process. But I hate when I hear, people get fit with hearing aids that they feel were so expensive, and then a month later they return them because they didn't have that support to kind of. They're not like eyeglasses. You're not going to put them on and they're going to make everything better, and everything's all of a sudden going to be clear. There really is this process, and you really do need to work with a clinician that's going to be able to help you fine-tune the devices for you, regardless of the price. And we'll keep rallying the government.
Thank you so much, Rebecca. I know there's a lot of more questions for you. We'll save them for the last
Sure.
period
Yeah.
of this.
Okay, thank you.
Okay, great. We want to make sure that we give all of our speakers a chance to speak. And next we have Brenda Poon. Dr. Brenda Poon is a senior research fellow and lead of the community research department at Wavefront Centre. She's also a faculty member at the University of British Columbia. Her community-based research program focuses on identifying and addressing barriers that make it difficult for people to reach and use services and supports. And she has a doctorate degree in deaf and hard of hearing studies from the University of British Columbia. Over to you, Brenda.
Thanks so much, Ruth. It's a pleasure to be here. I'm just going to load my slides up for just a second here. There we go. It's such a pleasure to be here. I'm just so pleased to be part of the panel today to talk to you a little bit about the research that we've been doing in partnership with the University of British Columbia called Breaking Barriers. And our focus is really upon primary care providers. So your family physicians, your general practitioners, your nurse practitioners, and how they play a role as being champions and instigators of hearing healthcare, and how they can play a role in ensuring hearing health for living well as part of our theme today. So what I'd like to do is talk to you a little bit about the background of the project and a little bit about our findings as well. So this project really started a few years back in about 2000, actually, where we had a chance to have a set of community consultations. And in that consultation, we had a graphic facilitator that came out, and we were talking about what are the sorts of challenges that are out there in relationship to hearing health. And what really stood out strongly was this role in terms of primary care providers, the important role that they play as being a first point of contact for health concerns, and really highlighting the role that they do play and can play within hearing health. So we learned that from our community consultations. We also know from some of the literature available that there's been some concerns that when older adults, for example, present with hearing concerns to their primary care provider, some evidence showing that only about 50% are actually being referred to hearing health care. At the same time, there's research out there showing that patients themselves see hearing healthcare providers as a person who plays a key role in the hearing healthcare pathway and supporting patients in their hearing healthcare decision-making. So a real potential is being a social influencer here for hearing health. So we took all that information from the literature and also from our consultations, and we were fortunate to be supported for a 3-year project that really was focused upon how can we support primary care providers to ensure patients with hearing concerns can access hearing health care and commit to treatment. And so we collected data over the course of a period of time that's focused upon understanding primary care providers and their knowledge, attitudes, and practices in relationship to supporting hearing health for older adults. The real focus of those who are over age 50 that might present with hearing concerns, looking at some of the barriers for primary care providers to make referrals, as well as some facilitators. So how did we collect the data? That's all on the left-hand side here, different sources. So really trying to get a perspective, the wider context of information with a literature review, as well as some BC-based information. So having a survey of primary care providers in British Columbia, as well as a series of focus groups, all with the end goal to come up with a few recommendations that we could provide for primary care providers in their role in terms of what they can do, what can they say when they meet an older adult with a hearing concern in their office. So we can inform some of those recommendations for that group of providers. And so I'll just share with you just a few findings today. So from our survey with primary care providers, we were really interested in the question of, do they see themselves in playing an important role in hearing healthcare? And we really did find that there was the vast majority of our 360 some people who responded to this question, over 70% said they do. They do agree with the idea that they play an important role in hearing healthcare for their patients. Now, we also wanted to ask them the question about what they're doing and how easy is it for them to support hearing healthcare in their practice. So we asked them to respond to a question about how easy or difficult it is for them to discuss hearing healthcare and assessment with their patients who are over 50 years of age. And what we found here is that, yeah, there's generally some, agreement. The majority, in terms of about 60%, agree that it was easy or it is easy for them to discuss hearing health with their patients. But we see that there's a little bit of room there, and that there's a cluster of respondents who were either neutral or disagreed with that statement, suggesting that there are maybe some barriers there or obstacles that are making it a little more difficult for them to talk about hearing healthcare and assessment. So respondents had a chance to give some open-end responses. And what we were getting back was that some of the barriers for some of the primary care providers is maybe feeling like they don't have the knowledge about the services out there, maybe about the availability of services, some questions about the quality of services, time constraints coming out quite strongly in terms of comments about primary care providers feeling like, hey, you know what, I just don't really have the time within the constraints of this appointment to be able to talk about it. And at the same time, sometimes not being able to talk about it unless the patient themselves brings up an issue. Another type of barrier that was raised was just also being a little bit confused, a little bit unsure for some providers about what came up previously through Rebecca's talk around coverage, some confusion about what's covered or not. So we know primary care providers also have that question, and that also influences their interactions with patients and what they feel they can share with them. So we had the survey results, it's just a few examples of findings, but we also did some focus groups. And those focus groups were really with 3 different groups of people. One group being the primary care providers themselves, so a mix of family physicians, nurse practitioners. We also had hearing healthcare providers in a focus group, so including our audiologists. And then also patients as well, or consumers, those that may have hearing concern themselves or hearing loss. And all of them were asked the same question. So we were asking them, what do you think? What would be what would you most want to see a primary care provider do or say to support a patient's hearing health? And so what's listed here are the top ranked responses. And there's some similarities here if you scan across them about what these groups thought was important to do or say. For example, across the board, we see that there's generally this idea of the importance of educating the patient about the importance of hearing and hearing health. That, along with promoting awareness, there seems to be the idea of the stigma or negative perceptions of hearing. And so how can there be a role for the primary care provider to change that perception and the stereotypes or the stigma associated with it? Also, some of the types of things that were viewed as important for a primary care provider to do is in the engagement in the referral process and the role that they play in making appropriate referrals. And that could be just engaging the process, maybe providing patients with a list of hearing healthcare providers, for example. Another stream that was consistent across was this idea of what primary care providers could also do within their clinics. So there were some suggestions, for example, of the importance of being able to do something within their session with the patient. Can they do some in-clinic checks? In addition to checking for wax, for example, can there be the in-clinic hearing screening that can be done? And that's one of the things that was brought up by hearing healthcare providers, in particularly as a highly ranked activity, as well as by patients, and even going so far as having more of a regular check. Can this be part of a regular check-in that the primary care provider does, maybe on an annual basis, around how hearing health is and doing an assessment of it? So we're really compiling the information about these ideas around practices, recommendations, and what we were gathering across all the different sources were a few different things. So there are a few threads that were coming through. First of all, we were learning that there was this emphasis on the practical parts of what a primary care provider could do. So the ability to do some kind of quick assessment, some kind of hearing screening tool that could support primary care providers, and also some information around what that sequence of steps are in terms of who to refer to and how. Primary care providers maybe there could be the benefit of having some kind of step-by-step or support process or guidance around what that pathway is or what that looks like in the British Columbia context. Also, as we've seen, and I've mentioned to you, the importance of education. So what is the role of the primary care provider? Maybe providing some support for the clarity of what that role is for a primary care provider themselves, and also for patients to have that clarity of a primary care provider and the supports they can provide to them. And we also know that there are all these practices that can happen, but there's still some of these systemic barriers. And some of the barriers are around attitude. So is hearing considered as important as other concerns? So do patients, for example, feel that hearing is as important as other types of health concerns? Do primary care providers also have that ability to consider its importance equally to other types of conditions? And what are the implications if that's not the case? And also some barriers around just the cost, which again was raised earlier about the cost of hearing supports and services and treatments that are associated with the follow-up care that might be recommended by a primary care provider. And then another barrier being that time element that I mentioned earlier. So primary care providers feeling like they just feel constrained for time. And so what can be done given the limits of time when, for example, the presenting concern isn't related to hearing health, but hearing health may be still valued. So how do we balance that? So those were some key ideas that cut across our data sources. We really wanted to come up with a recommendation from this work. And some of the recommendations really centered on, can we provide some kind of resource, some kind of hearing health resource that's tailored to primary care providers in British Columbia to really support them in some of these activities that I've mentioned, some of the practices that have been recommended. So we were really fortunate to have our community advisory group weighing in on the recommendations and the findings themselves from the project. And what came up strongly was this idea that there needs to be a resource that's really easy to read, it's quick to access, has resources available linked in it, one page, really just a one-page resource that primary care providers could go to that is like a flow chart of sorts and could really walk through some of the decisions that could happen. So if this, then this, for example, having this sort of path that could be provided to primary care providers as a tool. So our project did lead to some recommendations around what that tree looks like. And I won't be able to go into some of that today, but just to say that that's part of what this recommendation involves. It also involves, where do we put such a resource so that it actually can be used? That was a key part of our question. And so what happened is we were hearing over and over again that there is this resource in British Columbia, really developed in BC, by clinicians called Pathways. It's a platform that's used to support the referral process. It provides clinical resources. It has the ability for clinicians to log in and access resources that can support their patients in their pathway or journey across many different kinds of health issues or concerns. And so what happened is that our conversations with the physician leadership group there will be happening to see how we can turn this decision tree, this flow chart, into something that primary care providers in BC can directly access when they log into the Pathways website. And so that's really, really where we are in the process. So we're having those discussions around that so that eventually, for example, this would be a pathway that's accessed around anxiety. This is an example decision tree or flow chart. So what we're envisioning in the future is, could we have such a pathway in place for hearing healthcare for older adults, for example, so that primary care providers could log in, access a pathway like this to see what are some of the steps along the way that are provided as recommendations, and what are some resources that we could provide primary care providers so they can get some supports in terms of that hearing healthcare pathway and the conversations with the patients themselves. So that's really where we're at. And we feel like it's filling a little bit of a gap, because from what we understand from Pathways is there's not a lot of content yet to support primary care providers in relationship to hearing health, and in particular older adults hearing health. So we think that this could be something, and we hope it could be something that could be used as a resource and a tool for primary care providers in the future. So with that, with the theme of ensuring hearing health for living well, I'd say some of the takeaways are for us is that, we've really underscored, I feel, the important role that primary care providers have in promoting hearing health for hearing healthcare for older adults. And yet we recognize that there are still barriers that exist in terms of supporting hearing health. Other takeaways are, in relationship to what Rebecca said, if you have concerns for hearing loss, please don't ignore it. Please talk to your healthcare provider. And if you have the family physician that can be there as a first point of contact, going to them with your concern, or directly to your audiologist. But generally through our project, we're hoping that we can provide primary care providers with a bit of a tool to support them in their hearing healthcare journey. So I'll close with that and just say thank you. And I want to acknowledge our funders for this project, the Vancouver Foundation, as well as Michael Smith Health Research BC. And if you'd like to reach out to myself or to our co-investigator, co-principal investigator, Dr. Lorianne Jenstead, I've put our emails there as well. So thank you for your time today.
Thank you so much, Brenda. This is groundbreaking and probably one of the most innovative research projects in the country. So congratulations to you and your team. Let's just go to the question box and see if we have some questions for you. So I guess one of my questions is, was one of the concerns that primary healthcare providers had about giving information on hearing health due to what kind of education they receive as part of their medical or continuing education training?
Yes, that was raised. It was raised in probably our literature review, and also by those in our focus groups around. It's not really a focus from what we understand in terms of the educational training that would happen for those that are going into the primary care provider role in terms of our physicians. So it's an area that they thought that it would benefit from having some opportunity, for example, around continuing professional education. So that's one of the recommendations here, is that could some of the resources be available for those that are also in training or in the educational context as continuing professional development. But maybe in terms of your question, Ruth, could we even go a little bit earlier in the process to provide some of this information as part of the training for some of the students that are working to become primary care providers?
We have a question here in the for you. The question is, did it show men or women? And then the person, and that's one question. We'll go to the next one after.
In terms of differences between men or women, we didn't really see anything in our data pointing to a difference in terms of recommendations. So nothing standing out in terms of anything related to sex or gender differences there at all. Yeah.
So I think this actually is the same person that's saying sometimes it may be challenging with family physician to provide the support related to anxiety, isolation with hearing healthcare. And the research demographic, there's a question if there are more women who are primary care providers.
Mm-hmm. Yeah, I can't answer that question around the primary care providers in BC around the division there. But it's something yet to explore. I'm not quite sure if we'd find any of those differences in relationship to the approach to the interaction itself. But just generally across the board, we were seeing more things, more around the barriers that are constraining across the board for primary care providers, like the time barrier, and just also the idea about what to do next. I'd say that that's really cutting across the data sources themselves, those that are systemically affecting all primary care providers.
Okay, so thank you so much, Brenda. I think
Sure.
what we will do now is go to Michael Currie, who is our last speaker, but not least, of course. Michael Currie was born with a bilateral profound hearing loss, and he overcame the challenges with the use of hearing aids, FM systems, and speech therapy. And in 2001, he received a cochlear implant. Michael's been involved with the Canadian Hard of Hearing Association, including being part of the Disability Tax Credit Working Group. And he currently works as a cybersecurity manager at BC Hydro and is co-chair of BC Hydro's Accessibility Network, which is an award-winning group. And in 2024, he was honored as manager of the BC Hydro's inclusive team. Over to you, Michael.
Thank you. It's a pleasure to be here today. And I'm just going to share my screen right now. So thank you, as Ruth pointed out, my name is Michael Currie, and I was born with a profound bilateral hearing loss. I was outfitted with hearing aids. Now you have to remember, we're talking 40 years ago, and it was back when analog hearing aids were around. Analog hearing aids are not as good as the digital hearing aids today. So as you can imagine, Rebecca talking about ringing in the ears, I also had a lot of whistling happening because the ear mold will not work all the time or keep fitting. So I always had to get new ear mold quite frequently. I also had an FM system, which was kind of cool because you had to wear this massive equipment around my chest. I was kind of like strapped it around like a backpack. And I can hear my teachers everywhere I go. So all of my classmates will always jump up and try to listen to my hearing aids whenever the teacher was out in the hallway disciplining a classmate. As you can tell, over the many years of appointments, I've had many healthcare providers, from audiologists to family doctors. One of the things that I've noticed is a common theme, as Dr. Poon pointed out, is the communication barrier, which kind of drives that anxiety around it. So I'll talk a little bit more about that in depth here in a few minutes. I also had over 11 years of speech therapy. One of the things that I'm going to comment about speech therapy is that my hearing loss was so bad that in order for me to actually understand what the person was saying, I actually had to put my hand on that person's throat and feel the vibration of what that person's saying. Well, obviously, as time went by, I couldn't go around just grabbing everyone's throat, just not appropriate for today's society. Hearing aids were actually damaging my hearing. The hearing aids were so powerful that they were damaging my residual hearing to the point that I lost all hearing. So I was completely deaf during university, and it was a pretty quiet time of my life. In fact, I'm going to pause here for a dad joke because I have to give one. What did the ear say when it couldn't hear well? The ear said, I think I need a little more sound advice. After I graduated from university, I went to get my cochlear implant in 2001. I think this was the time where it really was a life-changing moment. And what if I told you that all the years before, I found it really difficult to understand what Helen Keller. For those that don't know Helen Keller was born both deaf and blind. She made a comment that blindness separates people from things. Deafness separates people from people. Throughout my early childhood, I thought it was better to see than to be blind. I never realized how important hearing was until I got my cochlear implant. Then I realized that hearing was really crucial for my social life. So throughout all of my childhood, I learned a couple things that I'd like to share with you. Number one, you have to accept your disability. I accepted my hearing loss just as much as I have to accept the fact that I'm getting bald. Or I'm 6 foot tall now. There are certain things about our health and our life that we just have to accept. I remember one time when I was at the Alberta School for the Deaf, and I noticed somebody being very frustrated with not passing or getting a good grade on their homework. They took out their hearing aid, they threw it on the floor and stomped on it. I was curious and I said, well, why are you doing that? And they said, it's because I can't hear is the reason why they failed. To me, it really came home to me that you really have to accept your disability, because it's not the disability that's stopping you from passing. It's your attitude and your ability to overcome that shortness. The next one is advocate for yourself. As I mentioned, I had many years of appointments and seeing healthcare providers. You really need to educate every health provider. A lot of them tend to have little to no self-awareness. And a great example is you go to the dentist, they start cleaning your mouth, and they start asking you questions. How are you? What's new with you? And yet, they have tools inside of your mouth, making it very awkward to talk. Just kind of like lack of common sense. It's the same thing when I go to the hospital, they wear a mask, I can't read lips, or even something simple as going for an x-ray, where you might have your back to them and you can't wear your hearing aid. There's a communication barrier. And that's something that you really need to advocate for yourself. People do not know how to accommodate you in your hearing loss, so you have to advocate. Next is the SS. There's a lot of information today, and even more today than ever before. When I was talking about 40 years ago, we did not have Google. We did not have smartphones. So you can see that we now have a world of information at our hand. And this is very important that you take advantage of all the resources that we have to help here. I want to take a quick moment to talk about how important hearing health is. As I mentioned before, the quality of life is really important. And as I mentioned before, hearing does connect me with people. And I never realized how much it connects me with people until I got my cochlear implant. And for that reason, it became my life mission to be with Canadian Heart and Hearing Association and to help people get hearing aids or to get a cochlear implant, because it really changes your whole life perspective. mental health, safety, all those factors are really important to maintaining your whole being as well. So if you think about it, if I can't hear, I'm not socially interactive, that isolation and it creates that depression, and that depression can lead to other factors. So keep that in mind. And I do know the challenge of trying to convince even my grandfather. It took us 10 years to convince him to get a hearing aid, even though I grew up around him with hearing aids all my life. So for those that do have normal hearing or good hearing, please protect your hearing. Practice safe listening habits with AirPods. Do not put Q-tip in your ears. They can actually damage your ears, or they can push earwax into the ear canal, which then you would need to go for cleaning. I would always say healthy and eat a healthy diet. I think we've heard already that you should get some regular hearing checked up. I mean, after all, we go get our eye checked out. Why not our hearing? Do it at the same time every year. We also heard a lot about hearing aids and devices and to support groups. So I mentioned the Canadian Heart and Hearing Association, and there are other support groups. There is a cochlear implant support group, and there are also tinnitus. I keep hearing different ways and variations of pronunciation, but tinnitus group also exists. There are a lot of support out there. And again, just go to Google, look it up, and you will find them. So with that, I'm just going to wrap it up really quickly here to summarize it, that there are a lot of information on the Canadian Heart and Hearing Association website, especially the BC chapter. They have an awesome hearing asset health kit available. You can download it and use that as part of your advocacy work. The Canadian Heart and Hearing Association also has a national website with a lot of additional information. Wavefront Centre for Communication and Accessibility is a wonderful audiology department, and I do recommend them for many different hearing and accessibility needs. And there's also the HealthLink BC, which is the BC government link. So with that, I do want to say thank you all for having me tonight. I'm sure you may have some questions, so I will turn it back over to Ruth.
Thank you so much, Michael. It's always fascinating to hear, even from someone you've known for many years, as I've known you, but I didn't know what you've shared tonight. So that's really very profound. And thank you for doing that and for being an advocate for those of us with hearing loss and helping to change things in society. So we're open to some questions for Michael. I'm just going to go to the little box here, the Q&A. Michael, do you have a mentor, coach, or a friend who helped you develop your life lessons?
That's a very good question. I have too many to number. I've had a lot of support from my family, my relatives, my speech therapist, all of my audiologists. They all supported me in my growth as a childhood and growing up. And they say that it takes a village to raise a child. And in this case, I had a village to help me accommodate my disability in there. So I can't call out anyone in particular, but I do have to say thank you to all those that have supported and helped mentor me and my disability. And I'll wrap it off with one last comment on that is, I remember one of my boss, excuse me, he would always send me to the classroom to fix an audio problem. And I look at him and I say, but do you realize that I'm hard of hearing, more deaf, and you want me to go fix the audio problem? And he said, yes, because you're the best at understand audiology. So the audio problem turned out I was right in the fact that I can't hear it very well, but on the flip side, he was also right because it not only pushed me to think about how I hear, but how everyone else hears in the classroom. And that together worked out to be a good acoustic environment for learning. So thank you.
We have 2 other questions for you. I'll give them to you both right now. What new technology do you find helpful? And what advice would you give to others who may be struggling with their hearing loss?
So the one is what new technology that would be helpful, and the other one is the advice that someone who may be struggling with their hearing loss. Okay. For me, today, I find a lot of the new hearing aids and cochlear implants come with artificial intelligence. It's shocking on how well it does in the listening environment, and it can actually switch back and forth between the different programs without you having to touch it. The second part of the new technology that I find very helpful is the Bluetooth technology. It's the ability to actually connect directly with the source of the audio. So for example, I'm connected to my computer, so all the sound comes directly into my head. The other thing for those that have hearing aids, they can also link the 2 of them together and actually hear on the phone at the same time with both hearing aids. So that new technology is just phenomenal. It makes a world of a difference in hearing. In terms of encouraging or other people with a hearing loss, I really find it challenging because people are very biased, just like my grandfather. He didn't think that he had a hearing loss, even though we had to correct him a few times and say, hey, look, this is what we actually said. And you know, there are things that can help you with it. He still had that bias or that personal opinion that his hearing loss, or he had no hearing loss. What I've noticed over the lifetime of interacting with people is that most people don't know they're losing their hearing. It's not the same as wearing glasses, and when you put it on, you see instantly the difference. It's the same thing with hearing. Once your hearing loss gradually goes down, you don't know what you're missing out on. And that's why it's very important to go for hearing tests. So, and the sooner you can do that, the earlier you can catch it and actually see that difference in gap.
Thank you so much, Michael. We're now going to open the Q&A up to all of the presenters. And we're going to go back to some of the questions that we had earlier. We have tons of questions, so it's going to be a little bit of a challenge maybe to get through all of them, but we'll keep answers as succinct as possible. Panelists, please. So the first question is, are T-switches still a consideration when buying hearing aids? Over to you, Rebecca, I think.
Yeah, great question. Yes, they are. They're still relevant, though, of course, with the introduction of Bluetooth that Michael just mentioned, that's another consideration. Lots of hearing aids still have Bluetooth and a T-coil. But some hearing aids, you can't have both. So it does require a sort of assessment of your needs. But telecoils work with hearing loop systems, and there are certain areas that are equipped with loops. So, you know, some public spaces like churches or theaters or airports, that's great to have a T-coil that you can activate. And some older phones that have that switch. But if you have no need for that, or there's other sort of assistive devices you can use in those environments, then of course the loop isn't as relevant. So it really does depend on the person.
So the next question is, should someone get their hearing tested at an audiologist, or would a chain store hearing test be sufficient?
I can answer that one too, I guess. It's kind of a hard question to answer. I don't like chain store. I would just recommend going to a clinic that is going to do a thorough diagnostic assessment and not just a quick screening with the purpose of trying to sell you a hearing aid. I know there's lots of quick kind of hearing screenings that you can get done. I would just recommend visiting either an audiologist or a hearing instrument professional that is going to, take the time to do a full assessment, check everything, and not kind of cut corners with the purpose of talking about hearing aids.
So the next two questions are about cost. So one of them is, why aren't hearing aid batteries considered medical equipment and covered under medical funding? Will there be coverage? And then there's someone who says, Work BC can help with funding for hearing aids. Anybody in particular want to jump at taking this?
I can answer that one too. So hearing aids themselves are considered a medical device. So some extended health will cover, a portion of the cost. But unfortunately, batteries are still considered like a consumable item, similar to like a eyeglass cleaner or something like that. Wipes, toothbrushes. So some third-party funding. So I know Caroline. Hi, Caroline. Thanks. Some third-party funding will, cover battery costs in addition to the hearing aids, depending on what type of funding you have. And the only other thing I'll mention is, of course, some people still need to use batteries and like to have that battery option, but there is a sort of a big push to rechargeable hearing aids, reducing the ongoing battery usage. So if that's something that would work, that's becoming a little bit more common.
So this next question here, I think is for you, Michael. What are some myths about hearing loss that need to be addressed? And someone has responded, you don't know what you don't know.
I think the myth is that hearing loss is kind of an invisible disability. A lot of people look at you and they don't see anything wrong. And they also lack the understanding or the myth that, and I'm going to use this word in a different way because we're very good at bluffing. We can nod and pretend that we're actually hearing you when we're not hearing you completely or fully. So there's always going to be the gap missing in the sentence or in the context of the communication being between us. So that's why it's very important that we advocate for ourselves. If we don't hear something, we need to ask them to repeat it themselves in a different way. Because otherwise, if I keep nodding and saying that's nice, but I could be saying something bad or inappropriate, let's just put it that way. So I do encourage everyone not to bluff and really maybe paraphrase the sentence or repeat back so that you understand that the communication is actually being understood by the other person that's talking. You don't know what you don't know. I don't know how to answer that question either.
I think it's probably just speaks for itself. We just don't, what you know, and sometimes other people know things that you don't. Other family members can tell you have a hearing loss way before you can tell. I'm wondering, Brenda, if this came up at all with family doctors, if see, they're relying on patients to tell them they have a hearing loss, but the patients might not know. And maybe the family doctor knows before the patient does. Did that ever come up?
It did, yeah. It was raised in terms of, and it's part of our decision tree as well. So there's that idea of if the patient themselves raises the concern, or if the primary care provider or the physician notices something, there's a breakdown in communication. So one of the streams is, do you notice that there's, something that's making communication difficult? So you follow a different path than you would for those that would identify it themselves. But I think it was a bit of an uncertainty because I think sometimes the primary care providers might suspect that there's a hearing concern, but that wasn't necessarily the issue that was a focus for the appointment being made. And so that's the whole issue of feeling like, well, relative to the concern that's being discussed, hearing isn't being presented by the patient themselves, but they suspect that it's an issue. So what do they do within this window of time that's very short? So that means it may not be addressed or it has to be left. So it was certainly brought up.
Very interesting.
Mm.
So we're now going to go to some other more technical questions that I think probably go to you, Rebecca. Is there a benefit to early intervention for hearing loss if you notice an adult family member starting to experience symptoms? Would intervention likely stop or slow down the progression of hearing loss? And will the brain be able to adjust better to hearing aids if the loss is caught earlier?
Okay. So hearing aids won't stop the progression of a hearing loss, but they can prevent some of the negative effects that might occur with untreating the hearing loss, like we talked about, like auditory deprivation. People sometimes say use it or lose it. Like if we're not stimulating that part of our brain, other parts of our brain will be activated. And we've seen that in like fMRI studies, that increased fatigue, listening fatigue, and social withdrawal. So yeah, the brain can adapt a little bit quicker to hearing aids if you haven't had such a long auditory deprivation period. We do need that kind of regular stimulation, hearing those words, to kind of keep processing speech efficiently. And we particularly see this with, like speech and background noise sometimes. Like you really do have to use that part of your brain that can selectively attend to different things. I have normal hearing and I can sometimes be in a really loud environment, but if I like really focus on something that I want to hear, I can hear it a little bit better. But if you're not doing that and getting all of that stimulation over time, it can be less smooth of an adaptation period if you're fit with hearing aids. So we do see better long-term kind of outcomes.
And there's a question about what the patient can do to manage chronic earwax buildup.
Michael mentioned this already, but not to use Q-tips. We can clean the ear will clean itself naturally, and it can sometimes work its way out on its own. Of course, if you have chronic earwax, sometimes that needs to be sort of addressed with a physician or an audiologist. There are audiologists and hearing instrument specialists that do get extra certification to take care of and help clean out earwax. So you could see a professional regularly for that. And sometimes they can talk about different types of oil that you can use to kind of help bring the wax out. Michael had a slide on this too. We don't talk about this a lot, but sometimes like dietary things and like staying hydrated. And I don't know if you want to, I saw that slide, but you didn't really talk too much about it, Michael, if you want to.
Yeah, it really depends on the body type and the makeup of the body. So my experience that I've had with earwax buildup mostly comes from wearing ear molds. Because ear molds are actually preventing earwax from getting out. It could also be due to the type of lifestyle or the living condition. So in Alberta, for example, when the weather's dry, it tends to dry up and not move. Where if you're in a more humid environment and you're working out, it tends to move a little bit better. So again, depending on the life circumstances, it can influence it. I find the biggest challenge is that we have a tendency to clean, being the biggest factor for most people around me that I've noticed. But other than that, drink lots of water and always get your hearing checked out, because sometimes if you're thinking you're losing your hearing, it could be due to wax blockage.
So we have a question, will there be more direct treatment in the future for sensorineural hearing loss?
Yeah, so sensory neural hearing loss, and I didn't talk about this in my presentations, but there's different types of hearing loss or different causes of hearing loss. And so sensory neural hearing loss is a damage to the inner ear cells. So when I was talking about that electrical signal that gets sent up the auditory nerve, that comes from the inner ear and those hair cells that respond to different pitches. So if those are damaged, that's where we start to see a hearing loss that is permanent, which we call sensory neural hearing loss. I can't really speak on it too much. I know there's a lot of ongoing research and scientists looking into things like gene therapy, like using certain types of regenerative drugs injected to see if it can grow the hair cells back. You know, that's all in very preliminary trial stages. I hope that we'll see it in my lifetime, but and maybe sooner. I know there's lots of work being looked at that, but I don't know any at this time. Right now, it would be, you know, hearing aids or cochlear implants that would sort of treat the loss.
Thank you. And now we have 3 last questions and only 4 minutes. So keep answers quick. I think they're all probably to you, Rebecca. So someone has neurofibromatosis 2. Right ear is lost 80%, left ear is still almost normal. Will I qualify for cochlear implant on my right ear? Will it help, or hearing aid is a better option?
So, like, I have to put on my old audiology hat for this one. NF2 is can result in like benign tumors, or what we call like acoustic neuromas on the auditory nerve. And so it would really depend on the condition of the auditory nerve, because a cochlear implant is like an electrode in the cochlea, but we still have to sort of send that signal along the auditory nerve to the brain. So it would really depend. I think you would likely need to have a cochlear implant evaluation done, and your audiologist could direct that forward. If the auditory nerve is still functioning and intact, then a cochlear implant could be an option. An MRI would like imaging would likely need to be done to do that. Okay, let me speed up. The hearing aid might work also, depending on the power. The other thing that comes to mind, and because your left ear, I don't see the question, but the left ear was normal, right? Yeah, normal
Yes.
on the left ear. So sometimes people can try what we call a cross hearing aid, and it basically sends it's like you wear 2, but it sends the sound to the good ear to kind of help you with some of that kind of localization. It's not going to create any sort of amplification on the poorer ear, but a cross is always something that you can just try and see if it helps. But I would just sort of check, you know, going through the process for that CI evaluation and working with your audiologist on what steps you could take there.
And I would just answer the follow-up question. This person is 62. Is this practical at her age? Yes, absolutely.
Yes, definitely. Yeah.
And then the last question we have is to follow up about T-switches. Do the latest models from the 3 CI providers have T-switches? Do you know the answer to this, Michael or Rebecca?
I believe they all do, but it's really up to how they're programmed. So sometimes they need to be enabled. For myself, I have mine disabled because I don't find a use for it in the program. So it really depends on how many programs you have for your cochlear implant and whether you want it enabled on one of them or not. So that's just something that you have to work with the audiologist. In terms of what's coming out in the future, I have no idea.
Okay, thank you. Excellent. We've answered 21 questions. I think that's amazing. Given the 3 very full presentations, thank you so much to all of our panelists. And I hope that those who are participating found it useful. We're going to follow up with an email. Several of you have asked if a recording will be available. And yes, we are going to be putting the recording on the Wavefront Centre website. And I want to close with thanking, besides our panelists, our interpreters, Dean Webb, Brianne Hall, and our captioner, Haley Hobart. Thank you so much. And there's another webinar that will be offered next week on March 13th that we want to bring your attention to. It'll be from 11 to 12 o'clock, 1 hour, a Zoom webinar by Wavefront Centre. And its focus is going to be on unlocking accessibility, assistive listening with modern solutions. So please go to our events page of our website for more information about this webinar that will talk more about Bluetooth, Auracast, what BedEar is, other solutions for better hearing. So thank you so much again to our panelists. Thank you to Gardana in the background who has run this webinar so smoothly. I think that everything went almost without a hitch, which is always something we like at our end. So we look forward to having you join us in 2026 for World Hearing Day then. But meanwhile, let's all work together to spread the important message about looking after our hearing healthcare, promoting a hearing healthcare world. Thanks again to everyone and good night. So I'm ending the webinar.